Thanks so much for joining us for this episode of the Invisible Americans podcast. We begin with President Biden's State of the Union address on March 7th. Yes, he did call for the restoration of a child tax credit. And then we talk with Amy Sutton of Crossroads4Hope about poverty and health issues like a cancer diagnosis that can lead to poverty. And then we wrap up with the founders of a terrific farmers training project for the LGBTQ community, Rocksteady Farm.
In a former episode, we asked Robert Gordon, an economist and President Biden's advisor on economic mobility, if the president would talk about child poverty in his upcoming State of the Union address. To our excitement, with over 32 million people watching, Biden did.
Folks at home, does anybody really think the tax code is fair? No! Do you really think the wealthy and big corporations need another $2 trillion tax break? No! I sure don't. I'm going to keep fighting like hell to make it fair. Under my plan, nobody earning less than $400,000 a year will pay an additional penny in federal taxes. Nobody, not one penny. And they haven't yet. In fact, the child tax credit I passed during the pandemic cut taxes for millions of working families and cut child poverty in half. Restore that child tax credit. No child should go hungry in this country.
Having been passed by the House, the Senate is still considering a new child tax credit bill as part of a tax proposal that will also give major breaks to big corporations. As of this recording, it is uncertain when or if the bill will make it out of the Senate and in what form.
But days after the State of the Union, the president released his new budget, which calls for the reinstatement of his expanded child tax credit that existed under the American Rescue Plan in 2021. That one cut child poverty in half. We'll keep you posted.
We were especially moved by our conversation with Amy Sutton, the CEO of Crossroads4Hope, a cancer support organization available to anyone who has had a cancer diagnosis themselves or their children now facing recovery.
Amy, thanks so much for joining us today. You raised in our awareness a problem that people often don't think about, and that is what happens when you get a cancer diagnosis. If you're not in the poverty realm already, the chances that you may get there because of the costs associated with it are high. Talk to us a little bit about why you do this work and how it actually helps our children in poverty.
Thank you so much, Carol and Jeff, for having me talk about this important subject. So our organization, Crossroads4Hope, a network of cancer support, is framed by the principles of social work, which is rooted in social justice. And so our whole philosophy is on meeting people wherever they are as individuals in the context of their family and their community. Cancer is a life-threatening health crisis that disrupts everyone connected to a loved one who's been diagnosed. And that ripple effect extends throughout, the caregivers, the family, and the community. And so we're working to close gaps in cancer care to help make sure that people can get into care as early as possible, stay in care, and improve their quality of life and health outcomes. And to do that, you have to address people's basic needs. So if people are struggling with stable housing, financials, transportation, putting food on the table, all the types of issues that we are seeing happening in communities across the country, they're not going to be able to access care. And they're more likely to be diagnosed with late-stage cancer diagnoses, as well as die from a treatable cancer. So we're working to change that.
Wanted to congratulate you because I think this is really an advance in community care for cancer victims. We know they suffer. We know the victim himself or herself suffers, and certainly the family does. What are some of the services you extend to people for which you do not ask them to pay?
The first thing we do is help them manage distress. Because as you can imagine, along the entire journey with cancer, there's these major points of distress, but especially when somebody's first diagnosed. It's just a shock. People are not thinking about their mortality. And then it comes into clear focus when they get a cancer diagnosis. So we have to deal with those emotions. So we provide individual support, group support programs. We have a 24/7 direct to mobile My Go to support program that allows people to access support in their home whenever they need it. But it's designed to help people reduce their distress so that they can take in information and with that information, be able to move forward on their journey. So it ranges from everything from support to educational programs around the cancer experience, educational programs around nutrition. We have support for families programs to help the family as a unit deal with cancer and its impact on their lives. And we follow people from as early as possible, from before they're actually diagnosed, but at risk, all the way through treatment, survivorship, and for families and caregivers, all the way through to bereavement if necessary. So we're with people for the whole journey, as much or as little as they need us, but we're a lifeline along that continuum of care.
That's really incredible. Talk to us more about the nutrition piece of it. We would think of that as prevention as well as caring once you're diagnosed, but expand on that.
For patients, it's essential that they maintain their nutrition levels because it can impact their quality of their treatment. They may not be able to stay on treatment, and we know that malnutrition affects 80% of cancer patients, right? So we know in the United States that 60% of people are dealing with a chronic disease. So when they come into a cancer diagnosis, they're struggling already potentially with one or more chronic diseases. And now we're asking them to think about what they're eating. That requires resources, not just nutrition information, but we have to deal with the psychosocial issues around people's relationships to food, how cancer complicates that, and to give people hands-on experiential tools to help them learn how to, number one, eat healthier and then prepare healthier meals. Nutrition is one of the areas that people are not likely to get resources, unfortunately, but we are also starting as early as possible. So our nutrition programs are not just for adults and their family members, it's for children. Because the earlier we can start helping people to understand what they need to do to eat healthier, the better. American Cancer Society just came out with statistics that the cancer rates for young adults are increasing significantly, and they do not know why. Some of them are GI-related cancers, and that is related to lifestyle and eating. So the sooner that we can start, the better.
How many people are you equipped to deal with?
So we reach just under 6,000 people a year, and we're continuing to build our capacity to scale. And we serve people not just in New Jersey, we serve people nationally. And we are seeing need across the country, not just in our own state.
Can you talk to us a little bit about one of the services that you provide? I was so moved by the family who did not speak English, who didn't understand what their daughter's problem was, that in fact she had cancer.
Families are often overlooked in terms of resources. We hear a lot about the needs of children who are diagnosed, and rightfully so. But when a parent has a cancer diagnosis, or even in a child's diagnosis, there's other family members that need support. So just to kind of level set everybody's understanding about this particular area, 25% of all adults with cancer are raising children under the age of 19. It's a big number. And so you think about what it takes to get through your daily life. Now add a cancer diagnosis to that, and you're raising children. Most parents are not equipped to talk about cancer with their children. They don't know how to approach the subject, and oftentimes they just need that information. What we see, though, in vulnerable and under-resourced communities are just a general lack of resources that are available. So in the case that I was sharing with you, it's almost hard to believe that a family was not aware that their daughter's illness was related to a cancer diagnosis because the provider did not have a translator in their office. I love the name of this podcast because we see people who are invisible to healthcare, to their community, because they're dealing with cancer in the privacy of their home. They do not have resources to advocate, but they do need support, and that's why we're here.
How did you get interested in this to begin with?
So I started my career in industry. I started in human resources, and I made the decision that I wanted to be more connected to community. So I left that work. I was doing strategic human resources, which is all around change and helping organizations and people change. And I went into hospice care. So I got a chance to see the healthcare system downstream and how incredibly broken it was. And it left me with the impression that you only get one shot at this. If we don't do right by patients, what that looks like is potentially a bad death that leaves a legacy for that entire family. I went to work for the Red Cross. And in both of those experiences, after hospice at Red Cross as well, I saw the integration of social work and healthcare. Right. So in a disaster, you provide mental health services and health services. At hospice, it's nursing care and social work. And so the common thread was, what do people need in dealing with a crisis? They need both mental health support as well as physical support. And I think that's what this country has been trying to achieve, which is the integration of the person in treatment, not just treatment of disease. And that's essential. So that's really what drives me, and my passion about this work is because we're trying to elevate that need to have the person and their basic needs addressed in care, not just treatment of disease.
Are there particular federal programs you are advocating that are being completely or mostly neglected?
There's a lot of money going into healthcare, which I understand. But the work of community happens in nonprofit organizations every day. And there's fewer and fewer dollars available. I'm not funded by the government. We don't ask for health insurance reimbursement. We're funded by donors and institutional funders. And that investment in community is lacking. And I think there needs to be more of it, because we're able to innovate as grassroots organizations in ways that large institutions really can't. So, for example, we are implementing global models of community public health in New Jersey as a pilot program to try to address the needs in vulnerable and under-resourced communities, right? So we're putting public health resources into these communities. We're trying to train lay people through our Health Champion program. And all of that, we don't receive federal dollars for that. And if we can close the gaps in care, that has benefits to communities that are, it's not hard to quantify when you see the faces of the people that you're able to touch, who might not have survived their cancer if they had not connected to care or stayed in their care. So this is the work that I think, the government, I think, needs to consider programs that actually put more dollars into community-based nonprofit organizations.
Amy, tell us how people who are listening to this can reach you. What's the best way, and what can they expect the first thing to happen once they reach out to you?
So people can visit our website at crossroads4hope.org. They can call us at 908-658-5400, and they'll get a person who can help address their needs, meet them where they are, and help them navigate their cancer journey, as well as the various programs and services that we offer, and as well as community navigation of resources as well.
We want to thank you so much for the work that you do. It's absolutely essential. And in this time of crisis, you're doing the good work and doing it well. So thank you so much.
And thank you for raising awareness through this podcast. Thank you.
I'll thank you as well.
Rocksteady Farm describes itself as a queer-owned and operated cooperative vegetable farm rooted in social justice, food access, and farmer training. Operating in upstate Millerton, New York, it is training LGBTQ farmers while providing its produce as far south as New York City. We talk with the founders and co-owners of Rocksteady, D. Rooney and Maggie Cheney, about their exciting project. Thank you all so much. Maggie and Dee, we are so excited about your farm, about the work that you're doing, about the food security that you're providing to so many people who would not ordinarily have it. Maggie, do you want to start and tell us how this all came about? You're in Millerton, you've got, is it 12 acres that you are farming and providing so much food for everybody forever?
We have a big operation. It's been really fun. Rocksteady started in the spring of 2016 is when we started sowing our first seeds. So we are going into our 9th growing season, and we are a queer and trans run cooperative farm with the social justice mission to feed as many people in our queer community as we can through our food access work, as well as train beginner queer and trans farmers, both regionally, locally, and nationally.
Well, the interesting thing, the whole notion of training a farmer. I do see on your website that you actually have tractor training. So talk to us a little bit about that.
Inherently, I'm excited to be someone who transfers whatever I know onto other people, because, knowledge truly is power. And it's really important that, to me, to Maggie, to us, like collectively, that it feels really important to be able to transfer the knowledge, the skills that we've learned along the way from either really great mentors and instructors, or sometimes learning things not necessarily under the best of conditions. And so it's really important to us here at Rocksteady that we're creating spaces and environments that queer individuals, people of color, can feel safe and secure to be able to learn things that are not easily transferred. It's just really important that we're able to share what we know and get as many people trained up and skilled up in the ways that are really empowering, not just even to grow food, but yeah, you can be a tractor operator, maybe not be working on a farm. It could be for your homestead, or some of the other things that we've tried to skill other people up in carpentry. There, you can just apply it outside of farming, and that's really empowering.
Are there similar communities around the country?
Do you mean in like rural spaces, or do you mean in urban spaces?
Or I think we were thinking in queer spaces. Is your program replicated across the country? I mean, we think of you as the leaders, in this genre, so to speak.
Yeah, I feel like there's more and more projects like ours popping up, which is beautiful. I'd say no one quite doing it in the same way that we are. I think we're the only farm doing, tractor training workshops and like 2 weeks intensives that are real full programmatic specific trainings for queer and trans community members. But there are definitely more farms popping up who are run by queer and trans people who are now out, and they might dabble in some education here and there, which is really exciting to see happening more and more. I think what's great is that since we started, there's been like a huge uptick in kind of communications and networking amongst all of us as farmers. So we have listservs, and there's, social media that people are following each other across the country and across the world. And very much that's why we're doing what we're doing, right? Because we saw the need for it. We got feedback from our community that was really like, oh, can you step into this, right? Can you become more than just a farm? Can you really broaden what you're doing so that we can have this opportunity? So we've been really in community and listening to the people that we've been working with along the way to kind of keep building our programs out. So it's exciting. It's like it's a collective effort to get us to where we're at right now.
Tell us how that works, how people apply, how they get into the program. And then I want to talk about all of the food you produce and how you make that available, at least the vegetables on a sliding scale.
So we have applicants who, in general, usually have some like community gardening, kind of small scale farming experience, and are looking to Rocksteady to kind of skill up to maybe a larger scale production, kind of learn our systems, learn cooperative farming and business skills, like a little bit of a 2.0 experience if they've dabbled in the food production world. And then we also work with people who are brand new to growing, who are coming to our community work days and doing a lot of, communing with their community and like trying to bring joy into their lives in nature. So we get kind of both of those communities, some from New York City who are like urban and some folks who are already really rural. And we're a place that welcomes all of that.
Do your volunteers really enjoy distributing the food?
We don't actually use volunteers for distribution at the moment, but we have some volunteer days. So they're coming to the farm and they're kind of like helping us with projects like planting or like big like weeding projects. I know it doesn't sound exciting, but or building something on the farm, we have kind of more hands-on volunteer experiences for folks.
And tell us about the production on those 12 acres. It sounds like I was reading one of the questions on the website was, what vegetables do you grow? And the list was quite extensive. So do you determine in terms of poundage or whatever that you actually put out into the world during the season on your farm?
I have that number, but I don't know. Dee, I want you to describe. I can give you the exact number, but Dee, I want you to describe our growing practices.
I think it's important to note that we lease 12 acres, and within those 12 acres, not all of it is growable. A lot of it is like where our high tunnels are or the roads that we drive on to get to the field. So the most we've ever grown on or feel that we're able to grow on in those 12 acres is about 8 acres, maybe a little bit more than 8 acres. And at one time we were growing on all 8 of those acres. However, just due to us sort of taking a step back and looking at what that level of production was, like at our height, we were growing on 8 acres, had over 500 CSA members, and were doing about $40,000 worth of wholesale. And that was just in a 9-month period. And I think we did that for a couple of years. And that was actually in response to the pandemic itself, where, like large ag was starting to break and crumble, and folks locally here in Millerton and downstate in the city, their access to food was looking really tenuous and really people were scared. And that's when we kind of heeded the call to increasing our production to that level and really wanting to support our community members. We've since those times taken a step back. We're only growing on about 4 acres and serving about a lot less CSA members.
And CSA, for those who may not know, these are people who sign up with you to acquire some of your produce, and you do that on the vegetables, at least on a sliding scale.
The root of how we were founded, even though how we were back in 2016 is like a different time and space that we were, and our evolution has been beautiful. And where we are currently, we've always wanted to believe that fresh food is a right for everyone, and have made that one of our tenets from the jump, from our inception. And so what we have done through the years, and in partnership with other organizations and other farm projects, have been able to create opportunities and ways for community members, both here locally upstate and within the city that we serve, that they're able to either get food at reduced costs. Some of folks get fully what we call solidarity shares, or their shares are fully subsidized. And CSA stands for community supported agriculture. And really what that means is if someone is calling themselves a CSA farm, it's almost a subscription. You're providing the farmer with money upfront at the beginning of the season, and that influx of income is able to actually help farmers sustain themselves financially in the months that times can be really lean financially. And then once the season begins, the farmer will, be providing a set amount of vegetables on a weekly basis for about 7-8 months.
And to add to that, because of our sliding scale model, that allows us to have 75% of all of our food go to lower income folks. And so doing that through the CSA model, but we also do that through direct partnerships with community organizations and very grassroots run farmers markets that are purchasing, or we're donating produce to those markets and they're offering it to the community for free. We cater to the community's needs, right? We're not just kind of like, this is the way that we operate and it's only a CSA box and everyone has to do that, right? We really want to communicate with who's eating our food and make it accessible in as many ways as we possibly can. And I think we're super lucky to have been like leaning in the direction of fundraising and have a kind of model that allows us to really meet a lot of people's needs. And the sliding scale model is replicable. And I think a lot of other farms are looking to that model as something that they want to try and they want to do that is quite easy to do without the fundraising support. So that's like something that we also teach a lot of farmers about too.
So the fighting scale, can you explain it very quickly so our viewers understand what that is?
It can be a model that's in all different areas of the world. You can have sliding scale haircuts. You can have sliding scale grocery stores. It really means that people are paying what they can on a scale predetermined by that business. So it's up to the farm, in our case, to put out the scale from 0 to 1,000. And then we kind of guide our customers into picking which price point would work for them based on their income level. So we kind of describe this on our website and we direct, if you have college education, you own your home, you have a large savings, you'd be on the $1,000 end, and you would be paying more than you would at a grocery store, but you're doing that with a notion in mind that you're subsidizing folks who are paying way, way less and who cannot afford that. And then our end, on the bookkeeping side of things, we're making sure that it all balances out, right? So that we're tracking, so that we're getting the price point that we need to kind of make our end work.
How much of your time does managing this operation take?
A lot.
Yeah.
For the record, they're both smiling, that knowledgeable smile of every single second, right? For those who are in the city who would like to support Rocksteady, who would like to participate in some of the, the produce that's coming down, where can they find it? And how, I know we're going to give them your website, but where can they find it in the city, for instance, in New York City?
We currently have 2 CSA locations. One is in Manhattan and Chelsea at the Callan Lord Community Health Center, which is on West 18th between 9th and 8th Avenues, I think, or 10th and 9th, I forget, but it's on West 18th. And that's a drop-off site where, an individual will go to our website, they will select the type of CSA that they want, and they will pick the location. So you have an option to select the Callan Lord or the Brooklyn Community Pride Center, which is in Bed-Stuy, Brooklyn. And that's been both of those sites are long-term partnerships that are incredibly near and dear to our hearts. Yeah, and they're beautiful people and we love being supported by them.
Great. And when is everything available? What your season is? We're talking to you in the February, so to speak. And when will people be able to actually access the produce?
We're working actually very hard right now. So I just want to say there's a lot of winter planning work that it's a different schedule. So we're still working hard for everybody now. But the produce won't be available until the beginning of June, and that's available through the beginning of November.
Excellent. Well, Maggie and D, we want to thank you so much for the work you're doing at Rocksteady. Thank you so much for the work you're doing.
Thank you so much.
Yeah, take care.
I have sad news to report that Bernard Schwartz, a stellar businessman and a generous benefactor, passed away this week. We wish him and his family our greatest condolences.
Thanks so much for joining us on the Invisible Americans podcast, available wherever you get your podcasts. But we urge you to visit our website for transcripts, show notes, research, and additional information about our guests and their work. That's www.theinvisibleamericans.com. Please follow us on social media and our new YouTube channel. And our blog posts are up on Medium as well as our website. That's www.theinvisibleamericans.com. Jeff and I will see you the next time.